Let's talk about schizophrenia with leading psychiatrist.
Hello, I am Dr. Suresh Chakravarty, Professor of Psychiatry, Guwahati Medical College, Guwahati, Assam. So, I am going to talk with you about living with schizophrenia. Schizophrenia is a major group of psychiatric disorder, usually chronic, in which a person has a hard time deciding the difference between what is real and what is not real. Approximately all over the world or globally, 1% of all human beings are suffering from schizophrenia. This disease is characterized by delusions, that means some abnormal thought, hallucinations, that whatever we don't hear, that these people, they used to hear their voices, hear others' voices talking to them, although there is nobody. Then there is disturbance of some sort of thought that somebody is going to do him harm, or somebody is going to discuss about him, or somebody is following him. Abnormal behavior in the form of talking to self, social withdrawal, and most importantly, with some cognitive functions, that means deterioration of your higher cognitive functions. Somebody used to say that we can differentiate schizophrenia in symptomatology regarding is some positive symptom, that whatever the symptoms patient did not have earlier due to the disease process they have arisen, such as delusion and hallucinations, and negative symptoms. What we mean is that whatever the symptoms earlier the patient, the individual was having, they have lost due to the disease, just like your social asocialism, anhedonia, lack of pleasure, lack of volitions, all these things. Contrary to the common belief that regarding the schizophrenia or etiology of schizophrenia, it is not actually the disorder of mind, it is a disorder of brain. So, like other physical disorder, our brain also can have been affected by disease, and this is characterized by our thought, behavior, perceptions, and cognitions. So, the etiology, the causation of the disease may be in the form of genetic. There is some biochemical abnormality. There is some structural damage in the brain, and environmental has definite role in playing and becoming an individual to develop schizophrenia. It is a chronic disease with periodic remission and relapse if not treated early and properly. The important aspect of this disease is it is treatable. There are varieties of line of treatment in the form of medications, in the form of psychological therapies, in the form of behavioral therapies, and cognitive therapy. Now, how to live with schizophrenia is basically we have to change our attitude. It is like we have to think that it is not a disorder of mind, it is a disease of the brain. So, medicine has definite role in its curative process. As already stated, it is a brain disease. So, when it is treated early, the patients recover earlier. For this, the family, society has their definite role to play with. They have to give their support, emotional and social, as well as economic support to the patients. They have to motivate the patients, whether he is or she is taking the medicine regularly, bring them to the doctors for follow-up, and have to reduce their highest level of anxiety or highest level of what we call it the express emotion to the normal level, so that we can bring back these patients to the near normal level. And they have to, the family members or caregiver, they have to keep monitoring early relapse signs like, say, for example, sleep disturbances, talking irrelevant, or disorganized behavior, or so and so forth. Patients living with schizophrenia need our help. They are the part of our society, needs our empathy, not sympathy during their illness. So like other physical illness during their period, need our help and they have to be taken care of. One thing to keep in mind is that it is possible to live with schizophrenia with support from mental health professionals, family, friends, and adhere to the medications and treatment plan. A person with schizophrenia can maintain the lifestyle they deserve by eating healthy food, avoiding substances like drugs and alcohol, adheres to routine daily life, and if possible, using some physical exercise or plan for some social and recreational activity. Thank you for your patience hearing.